It begins next week for the Washington Health Benefit Exchange, and if you're not sure exactly which plan that you should be signing up for, you are not alone. And it gets scary. A lot of big words, a lot of numbers. Health is obviously one of the most important things we can think about as families, as parents, and things like that. So to kind of help navigate through these waters, we brought in an expert from the insurance industry to kind of help us see what is in front of us. And Gary Franke, thank you so much for joining us, an independent broker with Achieve Alpha Insurance. So someone comes into your office and says, help. What's the first thing you say about what's in store?
So the first thing is to sign up on the Washington Health Exchange. So we go and create an account and we get their information. So what we do is we help look up their doctors and prescriptions and help to figure out what their needs are, because all the carriers on the health exchange have more limited networks this year. So it's really important to make sure you get the right plan. What are the biggest changes that people should expect from 2017 to 2018? A lot of the PPO plans are going away. The prices are going up quite a bit. And then the CSRs, the cost savings reductions for the silver plans, are going up dramatically. So the key thing is to plan ahead, call an agent, go through and try to figure out what your networks are and try to stay in one hospital network or two from that perspective.
And enrollment, what's the timeline? When does it start? When does it finish here in Washington State?
So open enrollment is November 1st to December 15th for January 1st. And then January 15th is the very last day that you can sign up for a plan at all for the whole year.
Wow.
Unless you have a qualifying event. So if you lose your job mid-year or the things like that, get married or divorced, then you can switch plans. But November 1st to January 15th, if you miss that, you don't get insurance.
You talked a little bit about the prices going up. How much are we talking about?
We don't know yet. They released the prices a couple weeks ago, and then with Trump, with the cost savings reductions, they have to recalculate those. So mainly for the plans themselves, they're going to probably come out a couple days for us to see and analyze before we tell our clients.
Is there a specific group that's going to be impacted the most?
Yes. People that make right above where the subsidies cut off are going to be hit the hardest. So like the middle class. So a family of four that makes $100,000 a year in Seattle, that's a lot of money, but you're going to be paying significantly more. So they're adjusted based off your income. So if you make less money, you pay less. If you make more, you pay more. But there's certain cutoffs. So it's really important to work with an agent because we know where those cutoffs are.
And then you also, families, I know, then they try to not massage the numbers, but if I make $99,900, I'm at a whole different bracket. Do you see a lot of people trying to do that just to get themselves a little bit of a break, or are people so overwhelmed that they just say, look, you figure it out and tell me when I...
Oh, they absolutely do that. The problem is, if you make more money, you owe that money back. So it reconciles at the end of the year. So a lot of people massage their income down and they owe thousands of dollars back. So that's the negative part of that.
Right. What's the number one question people come into your office with, or the biggest stressor for them when it comes to signing up for health insurance?
It's their networks. It's trying to have their doctors covered. The problem is we have so many amazing hospitals in this area, and now the individual plans, since the carriers have been losing money, they have to pick their hospital network. So it's like, which one's your favorite doctor? Which one's your favorite child almost? So people that have more medical needs, super important that you make sure that your doctors, you want to call the doctors. The search tool for doctors and prescriptions on the health exchange is not completely accurate.
So call them.
Call the doctor's office themselves and talk with the billing department, not the front desk gal. From that perspective.
And what about Congress? I mean, they're still trying to work things out. We've been doing stories this morning on what they're doing this week. Might things change?
Change is constant right now in everything in health insurance. So if things change, they can potentially adjust numbers mid-year for prices. But if anything does change, it's going to take a year or two before anything is really implemented from anything that Trump does one way or another. The executive order that came by last week, those changes aren't going to be implemented for at least 180 days. So one thing I tell clients, don't worry, just sign up for a plan, you'll be okay. You're not going to lose insurance. You're guaranteed insurable still. That can't change.
All right, Gary Franke with Achieve Alpha Insurance, thank you so much for helping us sort this out. We've got your number on the screen if people need to reach you for some help in enrolling in healthcare.